We've been using dental monitoring now for about 12 months. Dental monitoring has been great for the practice because it frees up so much time for us. Being a Platinum Elite Invisalign provider, we see so many of those 10-minute reviews and it's cut all of those out. So we've now got more capacity to see patients. Our patients love dental monitoring because so many of them come from afar and they travel in. So for them it's been great because it cuts out those quick appointments every 4 weeks where they've got to come in for 10 minutes to be told that everything's okay and then to go away again. So from that point of view, it's been fantastic for them. During COVID, dental monitoring has been really helpful. Now, being in regional Victoria, we haven't been affected so much by COVID as opposed to Metro, but even during COVID, it's been great because patients have had that consistency and they know we know that we can still monitor them and look after them even though they're not coming in all the time. So they get the reassurance that they're still being looked after during the COVID. So for us, the biggest change has been fewer 10-minute Invisalign checks. And the knock-on effect of that is that we're now able to see more patients. But from a clinical point of view, the great thing is that I can check my patients every single week rather than checking them once every 4 to 6 weeks. And that means that if there's a problem, I can intercept that problem much more quickly, get them in for a refinement more quickly, and get their treatment finished more quickly. Yes, for patient compliance, dental monitoring has helped because it means that if they aren't wearing their chewies or if we can see a problem, we can communicate with them through the app and get them to either use their chewies or brush their teeth better or do whatever it is that we need to check. It also, the AI also picks up some other interesting things that I wouldn't have expected it to, such as the gingival recession and all of those, and some mucosal defects and things like that. So it means that we can actually check those straight away and we can keep an eye on recession and their gums and so forth. So patients today seem to want everything and they seem to want it right now. For us with dental monitoring, it means then we can give them their Invisalign treatment and we can have it comfortable for them because they can do everything from home. They don't have to come in all the time. Nowadays, most young people communicate by text message, so it's really natural and easy for them to communicate with us. And it's almost like they've got a dentist in their pocket or on their phone and they can just, ask questions whenever they need to and get an answer straight away and get that feedback straight away. So it increases compliance that way as well. Yeah, it's been fantastic for scaling because again, because we're freeing up so many of those appointments, we've now got more space in the book to see more patients. And dental monitoring has also helped us to attract patients because our patients, because we're in the country, so many of our patients travel from afar. It means they can still travel to see us and they don't have to then come in every 4 to 6 weeks to keep on seeing us. So, it's been a twofold effect, physically freeing up the book, but then also helping us to attract more patients as well. The dental monitoring onboarding process was really easy. The dental monitoring onboarding trainer trained up my dental monitoring coordinator, my DMC Rhiannon, and trained up Rhiannon on how to use the DM dashboard. And Rhiannon pretty much just does everything. And the great thing is that we've set up our protocols and our thresholds, so I only need to be told or informed when there's a specific problem. So the great thing for dentists is that it frees up so much of your workload because you've got your trained DMC monitoring all your patients, and you only get told when something is elevated above that threshold that you've set. Our staff love having new tech in the practice. We've been a fully digital practice for over 5 years now, and every year we've been implementing something else, be it CEREC CAD/CAM or digital implant scanning or iTeros or whatever it is. So this is just another digital technology that we've added to the mix in order to give a better outcome and a better service for our patients. So the girls have been really great and they've really embraced the dental monitoring. The dental monitoring coordinator role is the most important role within the dental monitoring framework because without it, you may as well to get the patients in to do the checks yourself. The whole point of having a good dental monitoring coordinator is that they do all of the reviews of all the scans, they do all the patient communications, and they do everything that needs to be done unless there's a problem where a dentist needs to act or intervene. So having a well-trained DMC is critical, and without having a well-trained DMC, you may as well just get the patients in to do the reviews yourself. No, I would definitely not return to the way things were before DM. However, the only thing I really miss about the old way of doing it was getting my patients in every 4 to 6 weeks and having banter with them during their aligner checks. But the great thing about DM is that you can still have a bit of that banter through the app, so we're not missing out in that.